Hello, my name is Dr. Farrell Burtman. I am a senior lecturer and the program director of the Coordinated Graduate Program in Dietetics. My research includes food security and nutrition assistance programs, inclusive health promotion, including dietetics from an anti-diet, weight-inclusive approach, and health equity. Please meet our NFAC team. The PI of NFACT is Dr. Meredith Niles. The team that you see listed here is composed of folks from the University of Vermont, as well as our current broader team in Maine. This is the team that was part of the health outcomes brief that we will be going into more detail with today. But I did want to take a moment to talk to you about the founders and the leaders of the NFAC team. Dr. Meredith Niles, Emily Belmarino, myself, and two colleagues at Johns Hopkins University came together to be founders and the executive team for NFACT back in March 2020. We were joined by colleagues at Arizona State University as well as the University of Arizona. Together, we developed the National Food Access and COVID Research Team. We have expanded to 18 study sites in 15 states, including Maine. In the map below, you can see where NFACT is currently conducting research. I also wanted to point out that we have a diverse team of researchers. We have associate professors, assistant professors, senior lecturers, PhD students, undergraduate research students, and postdocs. It is my pleasure to present these collective efforts that we've brought together to share with the Thrive community today. I am only a member of the team, but I'm very proud to be part of the NFAC team. Our research is developed to inform policy. We have three core principles. Work with stakeholders, such as yourselves, from the very beginning. In March 2020, when we were first developing our survey, we reached out to stakeholders across Vermont. Perhaps some of you are listening to this presentation as I speak. Thank you. We make our work open access to facilitate broader collaboration, public access outside of the university. We have also found, but by using open access, we are able to disseminate our information much more quickly than the traditional peer-reviewed process. We want to make our work actionable by prioritizing public communication outputs and engagement with policymakers. We have produced 12 Vermont policy briefs. We currently have 4 peer-reviewed publications, with several more under review as I speak. On the right, you can see examples of our policy briefs. Were you to visit nfactresearch.org, you can see our briefs as well as our colleagues' briefs from across the United States. Today, I will describe to you 2 different data collection efforts. Before I do that, let me begin by describing the different surveys that we have conducted as an NFAC team. Collectively, we have deployed 6 surveys to Vermonters since the beginning of the pandemic. We have a cohort survey, which I will describe to you shortly, and that contains 3 surveys. We have representative surveys, 2 of which are representative. We have a farmer and food business survey, and we did this in collaboration with the Vermont Department of Agriculture. Collectively, we have 6,700 Vermonter responses. We've conducted qualitative interviews with key informants. The data presented today is and later in my presentation, and with my colleague Jennifer, are a statewide representative sample. These are representative on race, income, and ethnicity. And I'm thrilled to share with you that we have more research coming. We have a forthcoming USDA Rural Development Grant for 2 additional surveys going out in 2022 and 2023. And of course, there are more opportunities for engagement. So let me first describe the data that I will be sharing with you at the beginning of my presentation. In this survey, we looked at a cohort of Vermonters 3 times during the first year of the COVID-19 pandemic to understand the impacts of the pandemic on food security and food access. The surveys were conducted in March, April 2020, June 2020, and March, April 2021. And I circled this March, April 2021. Those are the findings that I'll share with you today. A total of 441 Vermonters responded to all 3 surveys. Woohoo! The research I will present on the cohort study will share changes in their experiences between March 2020 and March 2021. Demographics in the study of our respondents were comparable to Vermont average demographics on race, ethnicity, and income distributions. But our respondents were more likely to have a college degree and to identify as female. Today, we will also be presenting to you research conducted in northern New England. This was conducted between March and June of 2021 to understand the initial and continued impacts of the COVID-19 pandemic on food security, health behaviors, and health outcomes. A total of 988 adults were surveyed, 562 of which were based out of Maine, and 426 of which were based out of Vermont. They provided information about food access and availability, health behaviors such as diet composition and exercise, and the use of habit-forming substances, before and in the year following the onset of COVID-19. I will present some of those findings, and my colleague and research collaborator, Jennifer, will provide more information about this study. So here are some key takeaways that I would like for us to think about today. About 1/4 of Vermonters are food insecure. More than half of Vermonters indicated anxiety and/or depression since the pandemic. Food insecure respondents are at a high risk for health impacts. They're more likely to stop or skip medications and increase substance use since the pandemic. And again, my colleague, Jennifer, will talk more about this point. Health equity implications are emerging and should be prioritized. The long-term health impacts are the result of multiple shocks to the well-being safety net, including food insecurity, lack of health access, isolation, costs of medications. And these require resources and coupling of programs. Let's explore food insecurity more than a year into the pandemic. The research that I'm sharing with you is from our cohort longitudinal study. We found that food insecure respondents were more concerned about food access challenges in March 2021 than food secure respondents. When comparing the different categories of concern, both food secure and food insecure respondents are more worried about food becoming more expensive. I would like to point out that this research was collected in March and April 2021, and we all know that food costs have been going up. Our current USDA survey is also collecting data on concerns about food costs. Food insecurity, again, is down, but still higher than before the pandemic. Food insecure Vermonters are working Vermonters. We found that 71% of food insecure Vermonters were working, retired, or homemakers. My colleague Jennifer will discuss this further, but I wanted to begin by sharing with you how we defined food security. We used the USDA definition for food security, and that is, food security means access by all people at all times to enough food for an active, healthy life. In order to collect data about food insecurity, we used the USDA 6-item food security module. Here you can find that food insecurity rates increased during the pandemic and remain above pre-pandemic levels a year after the start of the pandemic. Food insecurity rates dropped by 24.5% between March 2020 and March 2021, but were 22.9% higher than pre-COVID levels. 31.6% of respondents experienced food insecurity at some point since the start of the pandemic. Of those, 46.9 were previously food insecure and 53.1 were newly food insecure. Food insecurity rates varied by demographic characteristics, and I will discuss those in more detail now. In front of you are findings that allow us to understand the percentage of respondents experiencing food insecurity in March 2020 by demographic characteristics. At the top, you will see our findings as they relate to BIPOC Vermonters compared to white Vermonters. You can see in these findings that 27.3% of BIPOC Vermonters experience food insecurity compared to 17.5% of white Vermonters. Let me now share with you respondents with greater odds of experiencing food insecurity in March 2021. 2.4 times at 2.4 times greater odds were women compared to men. 4.1 times greater odds were people without a college degree compared to respondents with a college degree. 3 times greater odds for food insecurity were people who experienced a job disruption at any time during the COVID-19 pandemic, and this is compared to respondents with no job disruptions. At 2.4 times greater odds for food insecurity were households with children compared to households without children. At 2 times greater odds were people under the age of 55 compared to people over the age of 55. As you can see, based on these findings, there are disparities among our Vermonters. Food insecurity has improved since the start of the pandemic, but is still worse than before the pandemic. 28% of Vermonters are food insecure. Why do we believe that Vermonters are still food insecure? Well, we have some ideas. Food insecure households pre-pandemic were more likely to lose their jobs. Many didn't get unemployment. And 52% of Vermonters with food insecurity had some form of job loss. There was a lag time in assistance. When we look at Vermonters who are using food assistance programs at the start of the pandemic, we found that 47% were food insecure. Inflation and rising food costs are definitely a concern. 81% of food insecure Vermonters worried about rising food costs. And again, as a reminder, these findings are from March 2021. We also recognize that recessions take time to recover. I also want to point out that we find that there are some demographics who do not recover at the same rate as other demographics. So who is most likely to be food insecure in Vermont? Those that are previously food insecure, households with children, low-income Vermonters, women, those without a college degree, BIPOC Vermonters, and LGBTQ plus Vermonters. In a moment, I will change over to data that we found most recently in New England. I will share with you some findings about the LGBTQ plus community. LGBTQ plus individuals, when we look into the literature, experience higher rates of health disparities, including denial of rights, social stigma, and discrimination. When we were reviewing our findings, our research team was struck by the comparison of LGBTQ Vermonters with non-LGBTQ Vermonters. We found that LGBTQ plus respondents across both states were significantly more likely to be food insecure before and during the COVID-19 pandemic. LGBTQ plus respondents were 4 times more likely to experience depression, anxiety, and they were more likely to be diagnosed with hypertension. My colleague Jennifer will describe the health outcome brief in more detail. I decided to connect this information with my portion of the presentation since I took a deeper dive into demographics and greater odds that we find among different Vermonters. Now I would like to turn to you as I wrap up my presentation. Using the chat box, would you please write the following? What are major areas of need or interest in your agencies or organizations as it relates to COVID-19? By sharing your ideas, our team can think about ways that we could expand our survey or present our survey or direct our survey to meet the needs of your agencies and organizations. Please take time now to share your areas of need and interest in the chat box. Before I turn over the presentation to my colleague Jennifer, I would like to share with you some implications for policy and moving forward based on my portion of the presentation. We find that there is a continued need to support assistance programs in the state of Vermont. We encourage people to invest in healthcare access and promotion of preventative care, including messaging around non-COVID etiologies and social determinants of health. We encourage that policymakers and organizations and folks in decision-making positions prioritize initiatives that address health disparities and potential health inequities during the recovery. Finally, I would like to take a moment on behalf of my colleagues to talk to you about ways that we can enhance the use of academic state and academic nonprofit partnerships. We would love to collaborate and think through and discuss ways that we could utilize faculty, grants, and students to advance Vermont health priorities. What projects could students and faculty implement with your organization or agency? Are there service learning opportunities and perhaps dietetic internships? Are there university and nonprofit partnerships that we should explore? Please feel free to share your ideas in the chat box of this presentation, and I look forward to our question and answer portion of the presentation. Thank you for your attention. It was a pleasure to present to you today.
Hi everyone, thanks for joining us today as we talk about exploring the effect of COVID-19 on health outcomes and implications. And I'm Jennifer Laurent. I'm one of the study team members. I'm an associate professor of nursing and also the vice chair and program director of graduate studies at UVM. So just to tell you that I have no disclosures, financial or otherwise, and this project has been funded by the Gun Catalyst Award at UVM. And a little bit of an overview of what I'm going to present today is looking at the data, discussing food insecurity and where we're at, what our current findings are, our key takeaways, and where to go from here. So this is just a synopsis of what we've been up to in the NFACT team, which is the National Food Access and COVID Research Team. And we've collected a series of 6 surveys. However, the data that I'm going to present today has to do with March and June of 2021. And that is the survey that actually included some of the health outcomes that we're going to discuss a little bit further on. It's important to note that the data is representative of race, income, and ethnicity, so we're fairly confident that we have a good representation of what Vermont looks like. So before we get into the actual findings of the study, I just wanted to define what we used as food insecurity. And the definition was that affected individuals and families lack access to enough food at all times for a healthy and active lifestyle. And we used the USDA module to determine if individuals were food insecure. And so we have another couple definitions, and one is newly food insecure. And these are respondents that reported being food insecure within 4 months of data collection period, which is the summer of 21. Then we had individuals that we defined as persistently food insecure, and so those are individuals that prior to the pandemic in March of 2020, they are identifying themselves as food insecure, and that food insecurity persisted throughout the study period up until the time we collected data. So where are we at 1 year into the pandemic? And again, now we're almost 3 years, but this is again representative of 1 year. And we found that about 28% of food households were food insecure. What really was interesting to us is that 71% of those individuals who reported that they were food insecure were actually working. So they were employed or they were retired or acting as a homemaker. So this is a little bit of a shift of what we think of when we think of food insecurity as affecting much more of that low socioeconomic homeless population. So what we're just getting into the data here, and we looked at those that were their dietary quality of those that were identified as food insecure or from food secure household. This slide is a little bit blurry, unfortunately, so I apologize for that. But here we can see that there's the percent of respondents eating less of a food group. So this is the dietary quality of individuals responding to the survey in the spring, summer of 2021. And here we can see, I'm going to walk you through this. We looked at fruits and vegetables, red meats, and sweets. And those of food secure households were reporting only a 5% reduction overall in eating less of a food group. So means that they might have had a little bit less consumption of fruits and vegetables, whereas food insecure households were reporting that about 32.4% of them were eating less fruits and vegetables. And there's a similar finding with those saying that they were eating less meat in the food secure, but almost double, actually more than double, when we look at the food insecure group. So what we're seeing here, and again, was true actually for sweets, but not as quite of a difference. So what we're seeing is that individuals who are reporting food insecure are actually really changing their diet quality in terms of fruits and vegetables, most importantly. And this is an increasing concern since this is only a year into the pandemic with inflation and increasing costs of fruits and vegetables, that we are likely to see a persistent, we're likely to see these findings persist, if not actually worsen within the next year at our next survey, which I think is actually going on right now. Here we examined body mass index and weight gain during the pandemic at 1 year post beginning of the pandemic. And we have the overall data, Maine data, and Vermont data, which we're going to spend a little bit more time with. And so what we're finding is that there are about 44 of our respondents that are reporting being obese, and another 25% are reporting overweight. So that's a pretty decent proportion of Vermonters that are reporting that they're either overweight or obese. And this is a little bit, well, it's actually significantly higher than 2020 data from the American Health Rankings, which pulls from the CDC and also the Prevalence data. Of increasing concern, aside from the fact that we're seeing a greater increase in obesity and overweight, is that about 43% of our respondents also reported weight gain during since the start of the pandemic. And we didn't assess how much weight gain, and that we'll look at future studies, but it is concerning that nearly half of the population is reporting some type of weight gain, when weight gain usually is not a helpful in the adult, during adulthood. We also found, and I don't think that this is any surprise to anyone, is that respondents with type 2 diabetes and hypertension also reported a higher body mass index. What was interesting is that we didn't find that the level of obesity in Vermont or Maine or overall was related to food insecurity. And so our hypothesis for this, because this is certainly contrary to different papers that have been published, is that it might have been a little bit related to the time of year in terms of when we collected our data. We collected it during growing season, where there might have been less people that were food insecure. We think of food insecurity as like a moment in time, where really food insecurity is this kind of fluctuation that happens over the years. Whereas at one point you might be food insecure, but at another point you might be food insecure. And also it may have to do with the longevity of how long an individual is food insecure. And we didn't really look at how long people had been food insecure and how that related to obesity. Here we examine chronic disease prevalence, and I'm going to walk you through this actual figure here. And we looked at the prevalence of chronic disease in our sample compared to national statistics. And so here we see national statistics in Vermont that about 30.2% of individuals endorse having hypertension, whereas in Maine about 36.2% of individuals. And these are from American Health Rankings, which again pulls from CDC and Department of Health and the Prevalence data. What we found in our survey was that we're pretty comparable, which also gives us a little bit of confidence in our sample and our sampling methods, is that in Vermont, we're seeing, according to our survey, that 29% are reporting that they have hypertension. And in Maine, again, similarly, we're seeing 35.2%, which is very similar to the national statistics. It gets a little worrisome when we start talking about diabetes. So according to national statistics in Vermont, approximately 3.7% of individuals report having diabetes, which to me, as a primary health care provider, it seems a little low. But our survey data actually reflected that about 9.9% of individuals are reporting that they have diabetes. Looking at depression, and I don't think that this is going to be really that much of a surprise. Sorry, my little figure there is off, but when we look at depression statistics, we look at the national statistics, again taken from breakfast data and American Health Rankings. About 22% of Vermonters are reporting a diagnosis of depression, whereas we were finding using the PHQ-9 tool that about 51% of people are endorsing depression at that point, which is incredibly higher than what we would have expected, and also incredibly higher than current statistics from a national level. And there is no national statistics on anxiety, but I think that that kind of goes along with the depression data. Again, gives us a little confidence in what we're finding, is that about 58% are reporting some sort of anxiety. And again, we used measures within the survey data that we currently are using in the clinical area. So in this slide, we're seeing that there probably are multiple impacts, often in the same people. For example, individuals with diabetes tend to also have hypertension. They tend to also report higher levels of depression. We also looked at medication adherence in our respondents, and we assessed them for stopping, skipping, or adding medication related specifically to the lack of money. And what we found here, and again I'll walk you through this slide, the dark cranberry is skipped medications, and then the kind of the oranges is stopped medications. Those that were food insecure had pretty low levels of skipping and stopping medication, which, you know, we all skip and stop and skip medications here and there, so it's pretty low. However, when we look at the data from those that are reporting they're food insecure, then it gets very worrisome in terms of seeing that upwards around 50 into the mid-20s of individuals are endorsing either skipping or stopping medication, specifically for medication for diabetes, hypertension, and depression. And what we found was that individuals who are food insecure were 7 times more likely to skip or stop their depression medications or anxiety medications, and 10 times more likely to actually stop their diabetes medication. So that's really concerning when we look at the future health of our Vermonters, actually the current and the future health of our Vermonters. And those that were persistently food insecure, so that again, that definition of being of responding that they were food insecure prior to the pandemic, and since 1 year since the pandemic, were 5 times more likely to add depression and anxiety medications. Again, so we're seeing the mental health or the concern about mental health really escalating 1 year into the pandemic. We inquired also about substance use, and what we found is that substance use has increased, and we found about 10% of respondents report increasing the use of habit-forming substances. So in this graph, I'm just going to walk you, or this figure, I'm just going to walk you through it. About 60% of our respondents are reporting any use of alcohol, cannabis, street drugs, or tobacco. However, we're also seeing that 10% of individuals are saying that they have increased their alcohol use. About the same for having individuals reporting that they're increasing their cannabis use, and just under for tobacco. We also see a small increase in the use of street drugs, and we really looked at street drugs in terms of kind of those illicit substances, whether they're opioids that aren't prescribed, or methamphetamine, cocaine, barbiturates, uppers, downers, that kind of thing. And we had an overall low rate of reporting any use, but we are seeing probably a third of those people reporting some sort of increased use. We also looked at substance use with regard to food insecurity status or food security status. And we found that alcohol use in those that were food secure only reported about 8.2% use or increased use versus those that came from food insecure. And we found that a very similar trend across all of our type of substances of dependence. And so that the far majority of, or not the far majority, the percentage of individuals that were food insecure were really probably turning to substances to a higher level. And we hypothesize that that probably is an indication of where they are in terms of their mental health and well-being. We also did note that there was an increased use in individuals who endorsed a job loss, lower education, and those individuals reported more cannabis use. Those that were persistently food insecure, so again, those that identified as food insecure prior to March of 2020 and 1 year in, also reported that they increased their cannabis or their tobacco use as compared to those individuals who were food insecure or newly food insecure. So the key takeaways from this data are that we have about a quarter of our population in Vermont identifying as food insecure. And I would imagine that as this pandemic, now endemic, continues, that we will be seeing increasing individuals endorsing food insecurity. We also know that there are definitely some health equity implications that are emerging and probably will continue to be worse than our data show now, because we all know that food insecurity is really a marker for a lot of the social determinants of health, which inadvertently determine whether you have enough money or resources to promote your own health and well-being. As an obesity researcher, I'm certainly concerned with the current level of overweight and obesity, but also the level of individuals that are endorsing weight gain, and that will probably again continue forward and certainly will exacerbate the chronic disease burden that we're seeing currently, and probably will have those long-term ramifications show up in 3 to 5 and maybe even around 10 years in terms of the health of Vermont. I think that this doesn't come to any surprise, but it's hopefully just a highlight of where we need to really place our efforts, and that more than a half of Vermonters are indicating that they have some anxiety or depression 1 year into the pandemic. We do know, and we've known this prior, so this won't come to any surprise, is that food insecure respondents are at higher risk for health impacts. So as we see more food insecurity, we're going to see more effects on their overall health. This combined with the increased likelihood of them skipping or stopping medications, again, will only increase the chronic health disease burden and obviously substance use. And so collectively, as we move forward, we're going to have to really consider how we can help those individuals that are food insecure. And these long-term impacts are going to really be a result of multiple shocks to the system. So we're seeing a combination of food insecurity, lack of health access, isolation, cost of medicine. And so all of this is a really significant threat to the health and well-being of our safety net, and will really require deliberate allocation of resources and coupling of programs. So what are the implications for policy and also moving forward is really looking at continued support for our food assistance programs, which is starting actually to decrease according to what we're finding, what we're seeing in the media. And certainly even as unemployment falls, we're going to have to continue to invest in health access and promotion of preventative care. Really looking at that one-stop shopping in terms of where individuals actually can gain food or food access points might be layered with support systems for their mental health and also their primary care, and perhaps even picking up their medication. So they go to one area and they get all those services. And really considering whether we need to do some medication vouchers for individuals who perhaps don't qualify for Medicaid but are underinsured, and so have to decide whether they pay for prescriptions versus using their finances for money for food and travel. And really prioritize those initiatives that focus on health disparities and health inequity during the recovery process, which probably will be slow. And then one of my take-homes is that we really need to take the investment as we shift into the recovery period and really reinvest in our preventative health efforts, and specifically focusing on those that are directed at obesity and chronic disease, as we know that obesity is really the underpinning event of a lot of the development of chronic disease. So what's next and how can we help? Well, we have a grant that we are launching currently, focusing on rural food insecurity and health outcomes during and since the pandemic, and to really look at the trajectory of individuals in terms of their health and their food security status. We're also looking at how we might be how our study and our team and our information might actually help inform your efforts. To recap our team, there's many of us here. I'm one of the newer members. We have Meredith Niles, who leads and is the primary or principal investigator of our work. And then, as you can see, we have a very wonderful professional, multidisciplinary team that carries out the work of the NFACT team. And so I will end there, and I believe that we'll be opening these up to questions that you have. And thank you for your time and your attention and your interest in our findings.